Thank you for your interest in the patient care advocate role at Express Scripts. We'd like to take a few minutes to share some information with you so you know more about Express Scripts and this important position at our company. Express Scripts is a pharmacy benefit manager which services the prescription needs of 1 in 3 Americans. We are a Fortune 20 company with approximately 30,000 employees. Our goal is to make the use of prescription drugs safer and more affordable. Think of us as the people behind your prescription card. The patient care advocate position is the face and voice of Express Scripts. These employees are responsible for managing calls from our patients and members regarding their prescription coverage. Just as every patient is not the same, not every call is the same either. You will have times where you'll deal with an upset or frustrated caller, but rest assured you'll be provided training and resources to manage those situations. While most of our positions sit in one of our contact center sites, we do have locations where PCAs work at home. If you've applied for a position in one of those locations, we'll review the expectations that go along with working at home a little later. Let's take a couple minutes to hear from some patient care advocates about the work that they do here at Express Scripts.
Can I please have the prescription number? All right.
A PCA is a patient care advocate, and that's a big role.
It'll be just a moment here.
There's a lot of responsibility, but a lot of reward as well that comes with the job.
You're welcome. And is there anything else I can assist you with today?
I would say on a typical day, in the call center environment, 60 to 70 calls, inbound calls per day, talking to patients about their inquiries, the medications that they have, and their needs that they've got. So it's pretty involved.
There's nothing more satisfying than helping our patients and letting them know that you actually did all that you could to resolve issues for them and get their medications out in a timely manner. It's a really rewarding position. To me, they're people just like I am. And so I try to think of myself and what kind of service I would want. And so it makes you perceive that person as a patient like yourself rather than just a customer.
And you talk to a lot of elderly people, and you talk to a lot of people that are going through a lot of things sometimes. You might talk to someone that might have found out they have a certain disease, or someone in their family just died, or whether it be helping them get their medication or helping them with their billing or explain their benefits to them to let them know if they could save money if they wanted to by using Express Scripts as a mail order.
Typical call, 2 to 3 minutes long. We've got the patient, we can verify their information, find their concerns, refill their medications, make sure their billing is all in order, answer any questions that they've got, perhaps about medications that they're taking, drug interactions and things like that. We can involve our pharmacy. So there's a lot of knowledge, a lot of information that's shared in such a short amount of time.
If you want to move up, there's room to move up, and they'll give you all the tools you need and the training you need and help you.
I decided to work from home when they asked if any of the PCAs would like to work from home, and I love working from home now. The most important thing I can probably say is not to take a call personally when they're very upset and they're yelling at you. Try to understand what they're going through, put yourself in their shoes, and how you would feel if you had important medication and you don't have it.
Fun it's definitely something that we take pride in here, and we take pride in doing a good job. You work hard, and sometimes you got to play hard. So it kind of fits in with all the goals of collaboration and mutual respect. I think the company really does a good job of putting its employees first, and this is just another example of that.
It's a challenging job. It comes with its challenges. It comes with its difficulties at times, and sometimes it can be really trying on you. But you work hard, and the harder you work, you put a lot of yourself into it, and you come away feeling successful and with a lot of pride in what you've done.
At the end of the day, I know that I actually helped somebody get their medication. I kept somebody from possibly dying.
So what makes a good PCA at Express Scripts? Of course, customer service is critical since this role does require you to manage a variety of different situations and calls. Being able to use your resources to resolve situations quickly is critical. Due to the nature of our business, being able to display empathy and show concern for the needs of our members is paramount. Express Scripts is a fast-paced environment where things can change quickly. Sometimes we may ask for you to change the way you do your work or even adjust your work schedule to meet our business needs. We'll provide paid training to ensure you know how to do your work so you can adhere to company policies and guidelines. Ultimately, it's up to you to report on time for work and provide exceptional service to our members and patients. Thank you for your interest in the patient care advocate role at Express Scripts. We look forward to learning more about you as you answer the questions following this video.